It's time for our visit with Dr. Kevin Kavanagh. Morning, Kevin.
Good morning, sir.
How you doing this morning?
Doing pretty good. Doing pretty good for Monday morning.
Okay, now, Dr. Kavanagh is very thorough, and he provides me with all kinds of notes here, and I noticed that you say tests have some false positives, and we're doing 1 million tests a day, so you're going to hear about wrong tests. I guess the more testing you're doing, the higher the rate of false positives is going to be, right?
Well, not the rate, but the absolute number. Let's face it, 1 million tests, that's a lot of tests. So you can have an excellent test that's very valid, has a very low false positive rate, but still have quite a few positive tests that are occurring every day. So people shouldn't get too rattled about that. And rapid testing, that's a different type of test. It's based on the same science, but it's designed to give you a quick result, and the downside is it's not as accurate. So you will see more testing errors with rapid testing than you will with your standard PCR laboratory test.
Remedisvir and interferon, I understand, are falling flat in WHO's mega study of COVID-19 treatments. Now, were these the two treatments that the president received?
Well, he did receive the treatment that was Remedisvir. That's another one. And the Remedisvir, we had another study out in JAMA, I believe, that also showed it didn't do much good. Maybe does a little bit, but as you said, they're falling flat. The main intervention that they have right now is steroids, anticoagulation, and supportive care, and the monoclonal antibodies. Those are doing, I think, really well. And both the president and Christie received the monoclonal antibodies.
And the hydroxychloroquine is just a dead dog, right?
It is, yes. We now have 7 randomized controlled studies that just show it doesn't work. And I think this is good for the public to realize that when you have retrospective studies or uncontrolled studies, many times it'll show an effect. But when you come down to the randomized controlled studies and really looking at this long term, it's a dud. And so we've kind of seen this with hydroxychloroquine, although people are still denying the randomized controlled studies. And unfortunately, we're kind of seeing it now with Remedisvir. We have 2 randomized studies out now that show that it's not giving as good of results as what's hoped for. The WHO study was I think, very discouraging on that drug.
And Dr. Fauci is making really big to-do about Thanksgiving and really warning people about having lots of family over. And he's really kind of basically saying, can we just kind of skip it this year? And, you know, obviously that's playing well with some and not well at all with others.
Well, and I can understand that, but it is a risk because Thanksgiving is a holiday where families come in from the outside, sometimes far away. States are surging with this virus all over the place. We are having increasing death rates now, increasing hospitalizations. And I really think that we need to take a look at, do we want to keep our family safe, or do we want to have this holiday this year? Nothing worse could fall upon a family of having a very joyful Thanksgiving and then 2 weeks later have people coming down with COVID, and 2 weeks after that having people dying. So let's try to do this safely, and maybe this year have a virtual Thanksgiving, especially if your family's coming in from out of state.
Dr. Kevin Kavanagh, thank you so much.
All right, thank you, Jack.